Following the decision by the United States to freeze funding to the health sector across the globe, Kenya is expected to lose $30.9 billion in funding from the Donald Trump-led administration. The effects of the stop work order is likely to be felt more by HIV, tuberculosis and malaria patients. According to Health CS Deborah Mulongo, the freezing of donor funding to the sector will have severe ramifications. Among the likely repercussions include a likelihood of at least 58,000 new HIV infections by 2030, with a further 23,000 tuberculosis-related deaths expected, 20,000 of which are those suffering from HIV. Mulongo also noted that the cut in funding is likely to see at least 12,000 malaria-related deaths annually. Despite the expected devastating outcome of the stop work order by the United States, Mulongo was quick to note that the government is also seeking diplomatic intervention.
We are engaging diplomatic interventions. On Wednesday, we'll be meeting the U.S. acting ambassador. We also need to allocate $24.9 billion for commodities previously funded by USG and disburse $2 billion allocated and allocate additional $2.5 for vaccines to avert funding freeze.
Other than setting aside funds to close the funding gap to be left behind, CS Mulongo opines that the government must also find more funds to facilitate immunization and purchasing of vaccines.
Other critical programs are the blood transfusion program, where $2.8 billion World Bank support is ending in March 2025. Immunization and vaccines, $11.6 billion is required. Gavi and USG support again is at risk, and the recommendation will need disbursement of $2 billion immediately.
With the effects of the stop work order by the United States set to be felt across board, with 41,000 PEPFAR staff set to be declared redundant, the CS called for the absorption of the staff and counties to set aside funds for the transition from donor-funded programs.
So our asks for the counties to retain all healthcare workers for integration, counties to set aside funds to aid transition from the donor-funded programs.
Mulongo also highlighted and called for the settling of debts owed to KEMSA, which continue to hinder operations, with her ministry owing KEMSA 1.4 billion shillings and counties having a debt of 3.5 billion. Ian Keitani for K24 Evening Edition.